There we go. All right, so we are live on our Facebook SC for Ed page. Thank you all so much for joining us tonight. We hope that this will be a useful hour for each of you that's tuned in. My name is Nicole Walker. I'm one of the board members of SC for Ed. And tonight was born out of an ongoing discussion between Dr. Greenhouse, who we have with us tonight, and Steve Newsom, as Steve, as a high school educator, has tried to sort of navigate between CDC recommendations for how we can mitigate the circumstances of COVID in our schools, and then the reality of what we are dealt with in the state of South Carolina in terms of a difficulty in social distancing, some issues with masking around the state, and a variety of other issues that we faced. And so Dr. Greenhouse was lovely enough to help us pull together a panel of experts tonight from our medical community. We also have some other board members with us who teach in elementary and high school. And we plan to have kind of a dialogue and really try to touch on some of the issues that we are all facing. Steve, Keely, Katie, and I are in the classroom every day. We're right there alongside of you guys. We understand the struggles, and we're really hopeful that you will walk away tonight with some new strategies and a little bit of hope. We're being moderated by the fabulous Judy Gatson, who just flew in from her work at WIS. We asked Judy to join us because we really feel like she has been able to see everything that's played out over the course of the last 18 months through that holistic lens, that she's gotten the big picture that we don't necessarily always get. And she is lovely and gracious as always, so she's helping us out tonight. I'm going to throw it to all of them to introduce themselves. But before I do, if you have any questions, I will be monitoring the Facebook page chat, and I can drop them over here. So if things come up tonight as we go along, feel free to ask us, and we'll get that information to you as quickly as possible. Dr. Greenhouse, do you want to start?
I bet. I'm Debbie Greenhouse. I'm a pediatrician at Palmetto Pediatrics in Columbia. I am a past president of the South Carolina chapter of the American Academy of Pediatrics and a spokesperson for the American Academy of Pediatrics on all things COVID and all things anything else related to children. And very happy to be here tonight. And I really, really appreciate everybody joining us. And I'm very excited about the idea of this collaboration going forward.
Dr. McFarland, you want to say hello next?
Hi, I'm Alicia McFarland. I'm a pediatrician with Sandhills Pediatrics, also in Columbia, South Carolina. I'm grateful for the opportunity to again participate in this collaboration, and hopefully we can accomplish a safe space for our kids to learn.
Dr. Bartlett.
Hi, my name is Emily Bartlett. I am a pediatrician at Palmetto Pediatrics, and I completely agree with Dr. McFarland. I'd love to come up with and collaborate on some ways to make a safe learning environment for our children. I have teenagers in Richland too, and I've been a pediatrician for 20 years.
Thank you. And Dr. Savitz-Smith.
Hi, I'm Jenny Savitz-Smith, and I'm a licensed professional counselor in Columbia. So I work a lot with children. My favorites are adolescents, although I have two almost teenagers at home. They'll be 13 on Monday. So it's getting real having it at home and at work. But I've seen lots of sides of the pandemic and how it's affecting kids and teens. and our college students. So I'm excited to talk about this. I really hope we can figure out some things and be able to help. I know I really appreciate all the educators. I don't know how y'all are doing it right now. So I just want you to know we really appreciate you a lot. And my hope is the schools won't close soon.
The other board members want to say a quick word?
I'll go. I'm Katie Harris. I am the director of area reps for SC for Ed, and I am an elementary school teacher. I teach 5th in York County, so I am up towards the north part of the state, and I'm kind of representing the young ones. Any advice you can do to help us with 10 and under, we would readily accept.
I'm Steve Newsom. I teach high school English and research, yeah, I am especially also worried about our elementary age kids, but we are still seeing a ton of our high school age students quarantined also, and I'm very concerned about our low vaccination rates. So as Nicole said earlier, I think a lot of times those of us who trust the expertise of medical professionals, we want to carry out a lot of the guidance that we get, and it ends up being either physically or resource-wise becomes either impossible to carry out, or there's not the politics get involved and it's hard to carry out. So I'm hoping that I know we can't solve all those problems tonight in this hour-long Zoom meeting, but I'm hoping that going forward we can talk about some things when we look at what resources and facilities we do have that we can actually do. I think at this point, without state action, we're going to have a lot of cases, but we obviously want to have as few of them as we can and keep our kids and our school staff also as safe as we can. I was mentioning right before we started that 2 more school staff deaths were reported today. It's getting much worse than it was last year. So even though a lot of school staff are vaccinated, I think we also want to think about how to keep them safe as well.
Hi, I'm Keely Hitchens. I'm also a board member with SC for Ed. I teach high school. I'm just trying to come up with ideas that will work in the classroom and help keep my kids safe and learning, because Dr. Savitz has meant that's obviously, I would like that to be what we're doing. So I'm excited to hear from everyone. And maybe my internet's terrible.
It's going to be okay. We can still hear you, Keely. As I throw it to Judy, I did want to just very quickly mention something I failed to say earlier. On Twitter today, we got questions about, why aren't there administrators on here? Why aren't there school nurses on here? We extended those invitations, and as somebody said earlier, this really shouldn't be political. Those people should feel as welcome in speaking out in the name of public health as others, but unfortunately they don't always feel that way. And so as we move forward, I just want everyone out there to, tomorrow, thank your school nurse, please. They are the hardest working people in education right now. I don't know how they're doing it. And thank your administrators, because they really are trying to keep everything together. They're doing the best they can too. And they aren't as able to speak as freely as the rest of us. So with that, Judy Gadsden, I am done talking. Over to you.
Listen, I just want to say thank you all for hosting this forum and for elevating the conversation. Our goal, as always, is really to put the politics aside and to focus on the children. I just want to say thank you before we get started to our educators, to our pediatricians. I know firsthand from my visits to schools and talking with teachers and nurses and from my own visits to the pediatrician offices, the kind of hours that you all are putting in and the situations that you are facing, and you are on the front lines of this pandemic. So I just want to say that to all of the teachers, nurses, administrators, our pediatricians, to all of you, thank you for your service on behalf of our children. Thank you, thank you, thank you. With that, I'm just going to lay out simple ground rules. Just keep it respectful, okay? We should be able to have this conversation and this debate. We're not going to tolerate getting off base and off topic, and certainly, not disrespectful or the personal comments and all of that. We're going to focus on the issue. And our goal tonight is very simple: how to keep schools open and how to keep teachers and students and staff safe. That is really it. That is our focus of this conversation this evening. So with that in mind, we're going to go through and answer as many questions as we can. A lot of you submitted questions ahead of time. We appreciate that. But if you're on the Facebook Live with us tonight, you have a question that comes up, you want to hear more about a particular topic, Nicole is monitoring the chat. She'll let me know. She'll jump in and we'll cover as much ground as we can in the time that we have allotted. And speaking of time, thank you for giving your time tonight. Time is a premium. I understand that. And so this investment that you're making of time tonight on behalf of our children and our community is genuinely appreciated. Let me start with the first question, which is, how realistic is CDC guidance in terms of what is actually happening in schools each day? And I think, that's why it's great that this panel has physicians and teachers on it, because there's a physician answer to this and there's a teacher answer to this, right? In terms of what the science dictates that is most helpful in slowing the spread, and then what's actually practical in a classroom. So Dr. Greenhouse, let me start with you, because and I would like you to explain, because some of this stuff I think we've talked about so much, people are confused about what the guidance is, right? So to explain what the CDC guidance is for schools, but also in explaining what it is for schools, because there was a differentiation, right? We were hearing 6 feet of distance, but then in schools, it was like, okay, well, schools can do 3 feet. And people question that because they're like, COVID doesn't know if it's in school or not. So that opened the door to question the science. So can you walk us through what the guidelines, the CDC guidelines are?
The official guidelines, the official definition of close contact still relies on that 6-foot guideline, which is more than 15 minutes, closer than 6 feet together in a total of a 24-hour period. But there were some studies that looked at school settings with the kids masked, and they found that if the kids were at least 3 feet apart in those studies, they really did okay. So that was where the discrepancy came from there, that we've got some pretty solid numbers saying 3 feet is okay, but you really still had the CDC saying 6. And as you said, COVID doesn't know where it is. So it really is a little bit difficult. And because of that's why you're seeing some schools and some school districts saying 3 feet, some schools and some school districts saying 6 feet, and basing their quarantines and things like that upon different numbers. And it really has been kind of confusing. But the bottom line is, whether you're using 3 feet, whether you're using 6 feet, you want the kids to be masked. The key to the safety in school guidelines is the layered approach. It's using every preventive measure that we have at our disposal to keep our kids safe. So that means distancing to the degree that you can. If you can keep the kids 6 feet apart, then obviously you should. In a lot of schools, I'm sure that simply isn't possible. Having all of the kids wear masks, everybody over 2 should be wearing a mask, including the teachers when they're indoors, other than when they're eating. Having as many people vaccinated as humanly possible, adults and kids above 12. Good hygiene, hand hygiene and otherwise. And then the other big one is staying home when you're sick and testing if you're sick or if you've been exposed. The guidelines are basically all of those things. And we'll have, our schools will be the safest if we utilize all of those things in a layered approach.
And we hear so much about that layered approach. Steve, I want to come to you and then Katie, because this is the other thing I hope people will realize, is that there is no one size fits all solution. Because as we listen to Dr. Greenhouse talk about this layered approach, the reality of being able to implement that is very different at a high school versus an elementary school. And it's very different at a public school than it is at a private school. Just real talk. So Steve, as you listen to Dr. Greenhouse lay out the layered approach, all of those strategies, how many of those are truly feasible at a high school, at a typical high school?
Unfortunately, with like real fidelity, I think that some of them are feasible. I think hand hygiene is the only one that we seem to have done a pretty good job at, because it's easy and it's cheap. I mean, and that's good. I think we always needed more soap in school, and we have it, and that's great. Distancing is not happening. 3 feet would be great. I have not been in a high school classroom this year or talked to anyone who's been in a high school classroom this year that has kids 3 feet apart. So when we have a kid out, everybody's, we have a whole corner or a whole section or a whole classroom that's quarantined because they're all close contacts. And as far as masking it, obviously, because it's been left up to the discretion of parents and children, it really just depends on the culture of the school. I think Nicole and Keely and I work at the same school, and I think we're very fortunate. Certainly not all of our kids are masking, but many of them are choosing to do that. And that's all I can really do, is just hope that they do it, suggest that they do it. And, we all love teenagers, but I think a lot of us have a lot of experience either as parents or working with teenagers, and suggestions aren't usually what they need. They usually need some stricter guidance than that. So I think I think about that layered approach a lot. And I think in schools we tend, because we're all overworked, administration included, we get fixated on one thing. Okay, can we mask? No. Okay, well, we give up. I think that's what's happened in a lot of schools. Or we give up except for the things that were really easy to do. I think like last year, a lot of districts got really fixated on plexiglass for some reason. So we'll spend all our CARES Act money or ESSER funds on plexiglass. And then when we find out that doesn't really do anything or isn't doing what we hoped it would, then we just kind of throw everything out the window, because politics do get involved. So realistically, right. I don't see any layering. I think we're either doing one thing kind of, or we're doing nothing.
Mm-hmm. Katie, what about elementary schools? What layering, in your observation, is practical, feasible for elementary schools?
I agree with a lot of what Steve said. Even on the elementary level, it's we're kind of choosing levels here and there that are working instead of putting them together to keep kids and adults as safe as possible. At the elementary level, just like he said in the high, hand hygiene does seem to be the easiest to control. But the spacing issue with elementary, I can imagine it's difficult in high school, but I do understand kind of the structure of the classroom is a little more, you stay in your seat, and it's a lot easier. With elementary, I've heard from teachers, it's kind of like herding cats in a classroom and telling a bunch of cats, stay 3 feet apart from one another. But as soon as you get one cat situated, 20 of them are moving. And so it's just not something that's really feasible. Teachers are desperately trying to keep kids spread out, but then you have situations like recess. And so then you have all the kids who are spread out for most of the day are no longer spread out. And so there's that. I agree with what Steve was saying with the choices we've been given, and with now like the legislature making decisions and with the parents making decisions, there's not a lot of layering and not a lot of control that teachers have in the classroom to keep themselves and their students safe. So we're picking what we can and we're doing the best we can, but as far as layering protections, it's just not in reality happening.
So let me ask this question. Lunch and release. This is the next question that came in, saying that they seem to be the worst times of day. And that kind of gets to what you were just talking about, Katie. It's like you do all this hard work to keep them apart. And then lunchtime, they're all in each other's lunchbox and on the playground, playing with different classes and all of that. So what can we do to help kids, high school is what this question is addressing, understand and remember to practice safe distancing? Keely, you want to jump in on that one?
Thanks for throwing me that really hard question, Judy. I'm not really sure. I mean, I work with ninth graders mostly, and I'm just always like, please wash your hands before you touch your food and try not to be all up in anybody's face.
Mm-hmm.
I just try to remind them of that. I say it every day. They get very annoyed with me. I try to discourage eating in classrooms. That used to be something I was really open about, but that creates other problems.
Right.
I don't know. Does anyone have a better answer
Well,
than me?
let me go to Dr. Bartlett because I know she has teenage boys.
It is because you
So
do
if-
spend so much time trying to keep them safe. They're wearing their mask in the room.
Right.
Then you see them at lunch and they are spending, 30 or 45 minutes unmasked, even when they're not eating.
You're
It's
absolutely right.
challenging to be like, hey guys, if you're not eating, maybe you can put it back on.
Keely, you're absolutely right. You're coming in and out a little bit. I know Wi-Fi might be an issue there. Let me go to Dr. Bartlett because I know she has teenage boys. Dr. Bartlett, any strategies for the teenagers, for high school, in terms of really driving home the point to them about social distancing and practicing these protocols as much as they can?
I think basically what Keely was just saying, it's difficult. Some people comply with rules and some do not. Reinforcing that we don't want them to get sick. We don't want anybody else to get sick. We don't want you to take it home to your parents and grandparents and other family members, and doing the best we can given the guidelines. It's a difficult situation to be in, and I'm glad I'm not, well, all we can do is tell our kids, educate our kids, and try to enforce what we can, but it's difficult. I can only imagine how difficult it is at a high school and especially the large high schools, how difficult it is.
It's very difficult. And as we talk about those complications, they're difficult for the kids to navigate as well. I've heard from a number of parents who say, first of all, as parents and even teachers, I know you've gotten requests from parents wanting to know who's wearing a mask in your classroom and who's not. And you can't really, be giving out a roll call of who's doing that. Parents are requesting, well, make sure my kid, sits by, somebody who's wearing a mask or vice versa, whatever it is. Teachers are not allowed to navigate all of that, but it creates complications in the classroom, and we really should be focusing on learning. And we're having to, manage, different opinions and scenarios about the mask. I want to go to our psychologist, Dr. Smith, and ask for any strategies for us as parents to talk to our kids about if one of their best friends is not wearing a mask, and even tells them. I've heard parents say, well, my kid's best friend said, you don't need to wear that mask. How do we need to help our children navigate those situations?
Well, there's a couple things. One is that kids really don't have a problem wearing masks. That when you get to middle school and high school, they are getting sort of that peer pressure about what are they being taught at home about whether to wear a mask or not wear a mask. And even in talking to my own kids, they say that like they use the term peer pressure and say the peer pressure at their school is to wear a mask. So they said, even if people aren't in favor of it, they wear it. I have some kids in other districts that I see in therapy who say they may be the only kid wearing a mask at school. And, they're wearing it on the playgrounds because they're close, and they're wearing it in the classrooms. But it's really hard for a kid to stand up for that. The ones that do, their parents are talking to them about what does the CDC say? How do we keep our kids in school? I mean, one of the things that I've seen the most with all age kids is that they say, I will wear a mask if I can stay in school. Because one of the things that we see this year is that kids don't want to go back to virtual. I mean, if they can help it. So you empower the kids, you tell them, like, if you want to stay in school, this is the thing you can do. And so I think it's just about positive empowerment. And one of the things too is to tell kids, this isn't it doesn't have to be about politics. And also, it's not about disliking someone who chooses not to wear a mask, but maybe just talking to them about, if we want to stay in school, we should wear a mask, or if we want to stay safe, we should wear a mask. And I do think kids will do that when empowered. So that's my thought, is the more we can empower kids, and that's from elementary up. I mean, kids do reiterate what they hear at home. And so that's the piece that I would say for all ages.
Well, listen, that motivation works because the young kids want to be in school to see their friends, right? The older kids want to be in school for their activities and extracurricular and to see their friends. So, that's the payoff, to be able to stay in person. I know some parents were upset about kids missing, auditions and special activities because they've been put in quarantine. But, your vote to stay in school is to follow the protocols. I mean, that's how you vote to stay in school. Doctors, we are getting a lot of questions in the chat. Dr. McFarland, I'm going to start with you because they relate to that follow-up about the eating in the classroom. So first of all, any advice for elementary students who have in the classroom? McFarland?
Yes, I think unfortunately that's unavoidable at sometimes. And I think eating in a classroom of 20 to 25 kids is probably better than eating in a cafeteria with 300 kids. So I think that might reduce risk some. Having kids be stationary, and if they get up to throw something away, put their mask back on. If they're wearing their mask, just remind them that might help when other kids are without their masks and still eating. I don't know if it's possible to utilize outside spaces or even hallways to let kids get more distance between themselves during lunchtime. Again, that's more of a logistics issue that I may not have all the insight as to how that would work, but it's not an easy situation, but just eat quickly and hopefully masks back on if that's happening in the school.
Dr. Bartlett, does eating behind a shield matter?
Can you repeat that, Judy?
Sure. One of the participants in the online chat is asking if during lunchtime, if the students eat behind a shield. We see some of the classrooms, not all, have the plexiglass. So does having that kind of barrier matter at all in terms of disease spread in the classroom?
I think it's all about the spacing and the putting on the mask. And when you're not eating, certainly a physical barrier, if you're really in close contact, may help some. Debbie, what do you think about that? I know that it would be best if you were spaced and you put on your mask when you finished eating. And, what do you think, Debbie?
I think that, like you said, if the kids are really close together and you can't space them, then a physical barrier may help somewhat, but there actually has been some data recently to show that plexiglass does not actually help. And in some scenarios, depending on ventilation and stuff, may actually make it a little bit worse. So I think it's kind of an individual thing. In some scenarios, there may be some benefit, but in some scenarios, there may actually be a little bit of harm. So I do think in a world of limited funds in the school, if you've got X number of dollars, for the most part, plexiglass barriers is not where you want to be throwing your money. I think there probably are better options for spending money.
And Dr. Greenhouse, I want to follow up on that with another question about the lunchroom, but you make a very good point, because we've been hearing at WIS from a lot of parents who had plexiglass in the classroom last year, and now they're upset because they don't see it there this year. And I think that brings to the conversation that this is a novel virus, right? And so things that we put in place with good intentions, that we now have more data to know it's not as effective as we thought it might be. And so with the plexiglass, in some districts, you can request it, but it's not going to change the protocol about whether you're considered a close contact or not. So it's important to ask questions because the situation and information changes as we get more data. Dr. Greenhouse, the follow-up about the lunch in the classroom, what would you suggest as the protocol in terms of wiping down the classroom first, in terms of the cleaning? A lot of that responsibility is falling on the teacher. And then for us just to understand how this virus spreads. Does it spread by us touching the same surfaces? Is it just, being in the same room and breathing? Give us a little insight about that.
It really looks as though the more we have learned about coronavirus, that the predominant method of spread is aerosol. So that's why masks make such a huge difference, because that child with a mask on sneezes, coughs, and those droplets are going into the mask. They're not spraying all however many feet away from them in the classroom. So the masks then really do become key. But as far as other protocols in the classroom, I think what Dr. McFarland said is key there as well. You want the kids seated, you want them in one place. If they have to get up to go throw things away, the mask really should be back on if there are other kids around them that don't have the masks. Certainly, I understand that there are parents who saw things in place last year, like the plexiglass, who are going to be upset because those same things are not in place this year. But I think that just speaks to the science that we have learned over time. The science has changed over time, and we need to pivot. We need to learn how to change with it so that we're layering and we're using the things that we know work, but we're not trying to rely on the things that really look like perhaps they don't work so much. As far as wiping down surfaces for meal times, like I said, we know it's predominantly spread by aerosol. It is not spread so much by direct hand contact. Now, that said, absolutely need to be having the kids wash their hands. I think if we have the time and we have the people to do it, wiping down the surfaces before they eat, wiping them down after they eat is absolutely a good idea. And some of that too is that not only do we want to try to minimize the spread of coronavirus, but there are so many other things that we're seeing right now going around our schools. We are seeing a ton of another respiratory virus called RSV, respiratory syncytial virus, that absolutely can spread by contact. We're seeing hand, foot, and mouth disease in the younger kids. We're seeing just all kinds of other viruses that are spreading because we're not using some of those same strategies to prevent them. So the things we're doing at mealtime really are things that will help us to prevent the spread of all of those things and keep our kids healthier and safer. Because what happens to that kid who catches RSV and is running a fever and coughing? He's getting tossed just like the kid that got exposed to COVID.
Absolutely.
So we need to try and mitigate the spread of all of those things.
Dr. McFarland, I'm going to come to you in just a second because we have a question in the chat about the best way to deal with a child who gets sick in the classroom and whether it's best to isolate them in that classroom or send them straight to the nurse's office. But before we get to that question, Nicole, I know you're monitoring the chat, but I think it's important to have some insight about how well we think contact tracing is working. And I know, again, this is very different from school to school, but I can tell you, I've talked to, I think, a dozen school nurses this week from 3 different districts. They're struggling. They are overwhelmed. And contact tracing is only really effective in slowing the spread if you can do it quickly and effectively. And it's really hard to do it that way right now. Nicole, what's your observation at your school about the complications of effective and quick contact tracing?
Well, Judy, I think another part of that issue is that the nurses have to be informed of the positives. And, I was having a conversation with my nurse today, and she said about a particular student, she's like, I'm so glad you told me because, we were 9 days in and she had no idea. And so, I think that is a challenge for them. And once you're 9 days out, it's really hard to go back and do that contact tracing. You kind of don't know how far that net has been cast. So one thing, is just urging parents, if you've had to quarantine your child, or if you do know, in fact, that there's a positive, please contact your school nurses as soon as possible. The faster they can do that contact tracing, the better. And, when you contact them, please know that they are on your side and they're doing the best they can. They want the best for your children, and that's why they've chosen to be there.
Dr. McFarland, I want to come to you with the question from the chat asking, is it better to send a kid with symptoms straight to the nurse or to try and isolate them in your room and just call the nurse and have the nurse come to the classroom to see them there?
I would think it would be best to go straight to the nurse's office as long as they have space and are not overwhelmed with 10 kids being sent there all at once. I think the longer they stay in the classroom with healthy kids, the more likely it is for the virus to spread. If it hadn't, if they were there for 5 minutes as opposed to 30 minutes waiting for the nurse to come down, it can make a big difference.
I want to broaden out the conversation, talk a little bit about testing. Right before this Facebook started, I saw the news alert saying that LA County schools are going to require the vaccine for all students who are eligible. I'm not even getting into that tonight. I want to talk about testing. Because nobody in South Carolina has suggested doing that. So let's not even interject that into the conversation. But testing is a critical component here, right? I think most people know, had COVID last September, and I was amazed that my boys didn't get it, my husband didn't get it. In my mind, the protocols worked because I quarantined my bedroom. I put on a double mask, and Dwayne delivered food and meds, and that was it. And they stayed upstairs. So thank the Lord, right? We see at Camden Military Academy, the protocols are working. As their headmaster put it, they have God first, mask second, social distancing third, screening and testing third, then social distancing, and the other protocols. And they have had zero cases since the beginning of the pandemic, okay? Everybody wants to argue about studies. That's just real life. And that's proof of the protocols working. But Steve, I'll start with you. The idea of testing, and I've asked DHEC about, whether this is something that they have explored about being able to work with school districts to provide testing on site. We do know that, because people ask me from time to time about the rapid test that the governor deployed, I think it was sometime last year, but there's a long list of protocols for that rapid testing. I don't know of any public schools that have the staffing or the resources, the extra space, the protocol set up outside to be able to do that. So it would require, some assistance from a DHEC or an outside vendor. What thoughts do you have about requiring that testing, incorporating that testing to be able to do that in a more efficient manner?
Well, I'm with you. I don't know what the logistics are, but when Nicole was talking about how difficult it is for us to know enough about who is sick to adequately contact trace kids, it seems like a no-brainer that if we could test even some of our kids, we would know more about who is sick. I know that the reality is most parents won't, I want to believe, and I think it's true, would not send their kids to school sick knowingly, but they may unknowingly send their kids to school sick. And there are parents who will, for various reasons, including some understandable reasons and some not so understandable reasons, send their kids to schools when they know they're sick. They did it when they do it every year with the flu. They do it every year with other contagious illnesses. Maybe they have to, or maybe they have to work or whatever. I think relying upon sort of self-reporting was a real problem even last year. We actually made a FOIA request to DHEC because we didn't otherwise know how we were getting information about contact tracing in schools, and that pretty much is what they said. And it's nothing against DHEC, because I don't know how else you do it without requiring testing. But basically, when someone would voluntarily get themselves tested, they would ask that person, do you work in a school? Do you go to a school? And if that person said no, then that was the end of the conversation. There's really no way to follow that up. If we were at least offering more testing, I think that would be great. I know that was something that we were explored last year, and a lot of districts said no. And I think they said no because it would be hard and expensive, but I wonder how many fewer quarantines and shutdowns we would have if we just knew, if the kid is sick before they go to class, then no one else has to be quarantined as a close contact. If we have to wait until they get sick, they've probably been, from my understanding, and I'm sure the healthcare professionals can weigh in better than me, but they've been spreading it for a few days probably at that point. So we missed that opportunity to keep them from getting other kids and staff members and everybody else sick. And so that's where we end up with these. It seems like every other day we hear of a school or a classroom or a district that's gone virtual because we can't get out in front of it.
And you know what, let me just take a quick moment because I've utilized it a number of times, and give a shout out to Richland 2 for the testing site over at R2I2 to be able to drive through. The app is user friendly. We got results even over the holiday weekend. So kudos to Richland 2. I'm sure other districts are working to do something similar, may have those things in place. Dr. Greenhouse, I want to come back to you because something else that we've seen that's been alarming, quite frankly, is that parents who are the same reason that Steve talked about, in terms of sometimes parents might, knowingly send a child to school sick, because they have to go to work, or they don't have, support at home to be able to leave a child at home. I mean, there are a lot of different things that complicate that, right? But I'm also seeing, social media where more parents, some parents, I'll say some parents, are suggesting that parents stop testing their kids. And they think that somehow that will alleviate, lessen the quarantines, and that COVID will just disappear. What concerns do you have about implementing that strategy of just stopping testing, especially of children?
So stopping testing and hoping that COVID just disappears is not going to make it disappear. The virus doesn't really care whether we believe in it, and it doesn't really care whether we test for it. It is just looking for other hosts to jump to, and it will find those hosts. And if we stop testing, then we will have more kids in our schools, and quite frankly, more staff in our schools who actually are bringing the virus, knowingly or unknowingly, to school and spreading it. And what I would fear most in that scenario, if we stop testing and we stop quarantining, is that the situation that we're already seeing in our children's hospitals would become even worse. Right now, the children's intensive care unit in our children's hospital in Columbia has been full for weeks. We have not had empty beds. Everyone still gets seen, everyone still gets the care that they need, but some of them get that care in the emergency room while they're waiting for an ICU bed. If we stop testing, and if we stop doing all of the things we need to do to limit spread and to mitigate this, that problem gets worse, because the more children get infected with COVID, even if the same percentage of kids get seriously ill, the higher the overall number is, the higher that percentage becomes. The more kids you have in your emergency room, the more kids you have getting admitted to the hospital, the more kids you have in your intensive care unit. So the end result of that approach, it doesn't end well. It ends badly. It ends up with more kids in the hospital, and potentially with more kids dying from COVID. So right now, as things stand, we can't take that approach. It simply isn't safe. We have to figure out a way to test the kids that need to be tested. I love the idea of doing more testing at schools. I realize there's lots of logistical barriers to doing that. And quite frankly, right now, access to the tests is one of those barriers as well. Just, I know our practice is having difficulty accessing the tests that we need for sick kids. It scares me a little bit to think, gosh, if the schools are suddenly using thousands and thousands of tests, are we going to be able to get any at all?
Yes.
So there's
Well, and I should mention that some news today from Washington was that the Federal Defense Production Act, I might not be using the full name accurately, but that where you can, have private businesses kind of deploy their resources to manufacture more tests, because they have had a shortage of the tests. And so now they're implementing that act to get more tests manufactured. And I think it was specifically a focus on rapid testing, but that for the next 3 months, they'll be available at cost, hopefully to encourage more testing and to try and get in front of this. Dr. Savitz, a great question for you from the chat, asking, what can we do in classes to reassure our children as they see their friends being called out and sent to the nurse? It's really terrifying for them, and it's hard not knowing what to say. You want to be truthful with your child, but you don't want to instill a sense of panic and fear. So how do we as parents navigate that?
One of the things that I would say is communication is key. So, and this is true of all ages, is the more you can, and And I've heard some teachers say, we're not allowed to talk about it in the schools, or some students, high school students say, our teachers aren't allowed to talk about it. And so I don't know what to do about that, except for to hopefully get where teachers can talk about it. And then obviously parents can talk about it too at home. But the more you can communicate and say, if you test positive, if your friend tests positive and you test positive, the one thing we can do is keep you at home and keep you safe and keep you from spreading it to other people. That you explain to kids not not very many kids get super sick. That the bigger issue is we want to keep you home so that you aren't spreading it to people who are immunocompromised, and you can explain what that is to kids or to grandparents or to anybody that would be at higher risk. And so, and one of the things I will say, kids are very scared of being out of school for 2 weeks. I mean, and so one of the things that teachers can do and parents can do is say, we've got your back, like we're gonna make sure you get your work, and for teachers to reinforce that and parents to reinforce that and just help kids understand, if you are out for 2 weeks, this is not like other years where we are like, stay in school, if you're not throwing up or bleeding or running a fever, you don't stay home. That we are doing this to keep other people well. And so I think the more we can communicate, the better kids understand it. And one thing that I've noticed on social media is parents who say, my kid tested positive, and are reducing that shame or that, guilt, or feeling like I didn't do enough. I mean, if you're doing all you can do with your kids, one, teens will be teens. And so sometimes, they don't have full frontal lobe development. So if they aren't wearing a mask, if your kid did not wear a mask and they're like, I don't think I wore a mask all day. When you ask them, like, were you sitting by so-and-so, that you don't shame them. Don't make them feel bad. Just say, it's okay. Let's just, let's get you tested, find out, go to the amount of time that the pediatricians say to test, and get your kid tested. Or I know if they're vaccinated, I think, I heard Debbie speak last night. And so Debbie had said, the window is shorter for people who are vaccinated than unvaccinated, and that with vaccinated, you're watching for symptoms. So, so that's the kind of things to explain to your kids, because they do so much better if they understand. And so we've got to decrease the shame, and we've got to increase communication.
Thank you so much for that. We're getting so many great questions in the chat. I do want to go through some of the questions that were submitted in advance, and we've touched on a number of them, but a lot of them have to do with DHEC implementing safety protocols. And I just want, to give a quick overarching view of that. DHEC did recommend to the board, Dr. Bell and Dr. Traxler and Dr. Simmer, the epidemiologist at DHEC, did recommend to the board that they make mask mandatory, that they add that to the CDC, to the state guidance, to our state guidance for schools. The board declined to accept that recommendation because of the provisos that are in effect, and they were concerned about legal complications that would imply. And so when I followed up on it, I was told that what the board did instead was to ask DHEC to reiterate to the governor's office that they do support a mask mandate in schools while disease activity is so high. So a lot of the questions that are, related to, what do we want DHEC to do? That's where we are in a realistic sense with DHEC right now. If I sum up a lot of the other questions, because I know we're getting short on time, it's going by so quickly. A lot of teachers and educators and parents even are asking if we are not allowed to have a mask mandate, if it's not practical to practice social distancing, what is the one thing that you would say can make a difference in keeping a classroom safe? I know that's like the $6 million question, and it's a big, broad question. And I don't know if somebody wants to jump in, but they're just asking. And I view that question as, what can we do to take charge? What can we do to be proactive, knowing that in so many other ways we are restricted in following the best guidance from our health officials? Who wants to tackle that?
Well, I'll jump in for a second there. I think what it comes down to is that we know we are limited in what we can do. And so what that means is that we really do have to take responsibility for this on our own. And that parents have to take responsibility for talking to their own children about it and explaining, okay, this is on us. We have to make this work. We can't rely on someone else to tell us what to do. So I think the one thing that is the most important, honestly, is communication between parents and their children. And that means that the schools and the school districts have to communicate with the parents. What are the things that we really want to happen? And that pediatricians and family physicians, because that's a lot of who's seeing kids in South Carolina, that pediatricians and family physicians have to communicate with families what things are the most important things to do and explain that to the kids and just reinforce. I've often wondered, would there be value in sending text messages to the kids? I mean, I am the parent of 2 graduates also of Richland 2, and the world's biggest fan of Richland 2 schools. But I wonder sometimes for these kids that live on technology, if we could send our middle schoolers and our high schoolers texts, just reminding them of the things that are so important, could that make a difference? Do we need to just think out of the box for the communication piece? So I really think the one thing that is the most important here is communication and personal responsibility. We have to do this ourselves. We've kind of had our hands tied to some degree as far as mandates and things like that. But to some degree, our hands being tied creates opportunity. And we need to take advantage of that opportunity. We need to communicate. We need to find novel ways to communicate that maybe we haven't tried before. TikTok videos. I mean, that's what our middle schoolers are watching. I mean, you get some teachers. Mr. Newsom here, get teachers a TikTok video and put it out there.
Absolutely, yeah.
I can see that. I can see that happening. Listen, Katie and Keely, I'm not ignoring you guys. There are a lot of questions for our doctor. So anytime you guys want to jump in, you let me know. I'm going to try and do doctors, just rotate through you guys to get some short answers on some really specific questions that were submitted. First of all, can you explain the importance of HEPA filtration? Is it worth it for us to purchase that ourselves? Dr. McFarland, you want to weigh in on that?
I think it could offer some benefit, but I don't know that it's going to give you as much benefit as simply masking. So, and I want to piggyback on what Dr. Greenhouse was stating. Just because you cannot require masks does not mean that you cannot strongly encourage them, normalize it. Speak to what the kids care about. Say, hey, you don't want to lose prom this year. Let's wear a mask so that we can stay in school long enough to see it. We don't want to lose homecoming. We don't want to lose our football games. We don't want to lose, all of the things that actually they do care about. And the masking is the way to do that. I'd much rather you spend your money on a whole bunch of masks and offer them to every kid when they walk in the door. If they didn't come with one from home, encourage. You don't have to require, but you can certainly encourage. And I know that didn't really answer the HEPA filtration question, but I think that's where your money's better spent on somehow getting the masks back in the schools. Would it help? Yeah, probably a little bit, but.
Okay. And look, I feel like we need to give every school a PlayStation to raffle away, but you have to wear your mask every day to get your name put in the hat or something. I don't know, whatever kids like these days. Dr. Greenhouse, let me come back to you. This question is, have we seen the Mu variant in South Carolina yet? And how is it different? Let me preface this question in your answer by saying, according to DHEC, and here's what people need to understand. Every person who tests positive, they don't run the test to see what variant that person has. They do a sampling of all the positive tests. And according to DHEC right now, 95% or more than 95% of the samples that they're testing are the Delta variant, which is more highly transmissible. And Dr. Greenhouse, if I remember from our last conversation with you and Dr. Bell, instead of with regular COVID infecting 1 to 2 more people with the Delta variant, it's 5 to 8 more people. Big difference. And so this question is now, what about this Mu variant that we're hearing about?
So the Mu variant has actually been seen now in 49 states. I believe the one state it has not been seen in, I'm thinking was Nebraska, but don't hold that to me. But I know it has been seen in South Carolina. There's a lot of questions about the Mu variant as far as how easily infectious it is. and whether some of the mutations in that variant may actually help it to escape the vaccines. Right now, it really doesn't look as though that's happening. And what I had read essentially is that, quite frankly, right now, the Delta variant has been so successful in being able to make its way through the community that the Mu variant really hasn't taken hold in very many places at all. Now, could that change over time? Sure, it could. What is the answer to that? The answer is vaccination. The reason that these variants are able to take hold is that our vaccination rate is too low. So you will continue to see new variants emerge over time and take hold in the community until you get your vaccination rate up high enough that that can't easily happen. That involves both having a vaccine available to kids under 12, but it also involves people being willing to get vaccinated so that our rates can get high enough to get rid of all of these new variants being able to escape.
Wonderful. Thank you so much. Dr. Bartlett, a question for you about masks. This person is asking, what kinds of masks are best for students? Should I go back to double masking or KN95 mask recommended as a science-backed choice, they're asking?
Well, any mask is better than no mask, and masks are safe. We do know that. KN95s are thought to be a little bit better than just a cloth mask. Yes. Are they readily accessible and available to as many as we need? Probably not for all of our students. But yes, that's the general consensus, is a KN95 is somewhere between a cloth mask and an N95. Quick answer.
I appreciate it very much because we are running short on time. Nicole, you let me know when we need to cut it off. Somebody's asking about contact tracing. And teachers, if you all want to weigh in on the complications of this, please do. But as a mama, I have found out contact tracing is very complicated. Number one, in elementary schools, because they're what they're doing, and it changes from school to school. We should also mention that DHEC puts out these guidelines, but school districts are kind of picking which ones they want to follow and what adjustments they might want to make, right? So what's happening in Richland 2 ain't happening out in LR5 and might not be the same as what's happening in Lexington 1. So just so that we have that basis of understanding. But, at this particular school, contact tracing involved the nurse walking in the classroom to see the seating chart and who's sitting around that kid. And then when the question was asked, well, what about who they were around at lunchtime, or what about who they were around at recess? They're like, well, that's up to the teacher to let us know. I'm like, oh, so that means we're not doing well, that's not contact tracing. I mean, it's just, I don't think, teachers, you weigh in, if it's going to be realistic to expect you to remember who interacted with whom at lunch, at recess, within the last 24 hours or 48 hours or whatever. Would somebody like to add to that?
Well, just quickly, I think somebody said this before, but the big problem, I think we know what they're doing in the classroom, but anytime they're not in the classroom, I mean, I have had a lot of success with the suggestions that have been made, saying things to my class, like, look around. There were twice as many people here last week. We don't want this to keep happening. We don't want to be quarantined. That works. But then I see the same kids in the hallway, and they're, making out without a mask, not literally, but they're very close. They're hanging out, and in another week they'll be making out. So they're good kids, so they follow the rules. But again, like frontal lobe, they're not transferring that to the rest of their day. So I think it is really hard to know. I would assume that the biggest place they're really in close contact is when they're doing those special activities, like they're on a sports team, they're in the locker room, they're in the bathroom, they're in the cafeteria, and then we have really no idea who is a close contact. And they might be together for a long time, but there's no seating chart for any of those activities.
Dr. Greenhouse, come back. I got 3 more questions in the chat that I really want to try and get to before we run out of time, Nicole. One is, Dr. Greenhouse, can you discuss the most prominent symptoms of COVID in our younger students? We often send our kids to the nurse or even to the pediatrician, coughing and sneezing, but they're sent right back because they don't have a fever. So how, with the symptoms being so similar, how do they differentiate and know the difference?
Unfortunately, it can be very, very difficult. Symptoms of COVID in young children can mimic the symptoms of almost any other viral illness. Gastrointestinal symptoms actually tend to be more common in children than they are in adolescents and adults. So that kid with vomiting and diarrhea, that could be COVID. The kid with the runny nose, the cough, the congestion, that could be COVID. The sneezing, not necessarily as much. Fever can be a sign, but they don't have to have fever by any stretch of the imagination. So that makes it really, really difficult for your school nurses to know who do they need to be excluding, who do they not need to be excluding. And it makes it difficult for us to know who do we need to be testing, because I certainly don't want to be the person who is clearing someone to go back to school who actually has COVID. So that makes me very liberal as saying, hey, we need to test you before we can say you're okay to go back to school tomorrow. But the bottom line is almost any symptom of a viral illness can be a symptom of COVID in a younger child.
Thank you very much. Dr. Bartlett, this question is about, that one teacher, I presume it's a teacher, saying, we've been told to open our windows due to concerns, or not to open our windows, obviously due to concerns about security, right? Because we want the schools locked down and safe from outside intruders. But now we're being told to open the windows, as an effective means of ventilation. So the question is, does opening a window make that big of a difference?
I believe it can, based on the size of the classroom and the number of people you have in the class. And if they're wearing masks, yes, opening window is great. I mean, I would love to hire, think outside the box. And are there some windows that you can open because it would be safer, or have an administrator outside of the school? I mean, that is asking a whole lot of our teachers and administration, who, by the way, oh my goodness, my hat goes off to all of you all. But the short answer is it can help, especially if you have a lot of people in a small classroom who are not masked.
Thank you very much. Dr. McFarland, do pediatricians have any sense of when vaccines for those who are younger than 12 might be available?
And there's a lot of rumors. We keep hoping that it's going to be very, very soon. The latest thing that I've heard, and Dr. Greenhouse, you may be privy to more of this information, but the latest that I heard is that we're hoping for approval by November.
I heard basically the same. Some folks are saying it may be for a little bit further out than that, potentially December, January. I believe that Pfizer is very close to being ready to submit their data for the younger children. But then once they submit it, then the FDA has to take it and look at it with a fine-tooth comb, because these are young kids. So the vaccine has to be held to a very high standard for both safety and efficacy before it's going to get approval.
Dr. Greenhouse, that leads to a question about safety. Let me find it so I can read it exactly as it was asked. It says, I'm still hearing a lot of people say for medical reasons they are not getting the vaccine. This is confusing because I've also been reading that there are no medical reasons not to get vaccinated. Can someone on the panel clarify, since not vaccinating seemingly puts others in danger?
Yes, it does. And there are very few true medical contraindications, reasons that you should not get vaccinated. I certainly would not say that there are none. There absolutely are some, but it is very, very infrequent. Anyone who is concerned should absolutely speak to their own physician about the vaccine. But the vast majority of folks can get the vaccine. I have organ transplant patients. They've gotten the vaccine. I've got patients with seizure disorders, with asthma, with rheumatologic disorders. They have all gotten the vaccine and they are safer for having gotten it. So there are very few true contraindications to getting the COVID vaccine.
And Dr. McFarland, how accurate are rapid tests for kids versus the PCR test? Can we trust the rapid test?
So a lot of that depends on timing and symptoms. The rapid test, this was one of my hesitations with the school starting testing, because if you're sick for the first day of symptoms and you go straight to the nurse's office and get a negative rapid test, that may give people a false sense of security, where if they're tested a day or two later, that test becomes more accurate as symptoms evolve. PCR tests are certainly the most accurate, but those have the drawback of having to wait for results. So I think you have to kind of take everything with a grain of salt. If you have a child who has suspicious symptoms and is exposed, and you have a negative rapid test, then maybe you continue to isolate and retest in a day or two, or send off a PCR for confirmation. I think they definitely have a place because of all the necessity for contact tracing and how quickly that should happen to help reduce the spread. You know, you have to weigh out the pros and cons of doing the rapids versus the PCRs. We're doing mostly rapids in our offices, though.
Gotcha. I want to go around before we wrap up, have each of you say one thing that we personally can do help keep our schools open and keep them safe. But I want to cover 2 points before we get to that. I just want to give you guys time to think about it. I mean, everybody can say masking, but if there are other things that you can think about, please do that. I wanted to get our doctors to weigh in on one more issue, though, and any of you can weigh in about this. The issue of, and again, let me qualify this by saying DHEC has guidelines, but schools are, they have the latitude to figure out how they want to implement those guidelines, if at all. So the question is this: if you have a sibling who tests positive, in terms of going back to contact tracing and testing, and what as a physician, what you would hope the protocol would be, should the other sibling who hasn't maybe displayed any symptoms also stay out of school? Should they have a negative test to go back to school? How should that be handled? Because that's another thing I'm hearing from parents is that, and because the mamas talk, the daddies do too, but we know a lot of stuff before we get the call from the school nurse. You might see one sibling there and like, hey, but we know the brother and sister, tested positive. What is the common sense guidance that you would offer to parents in terms of dealing with siblings where one may have tested positive and you don't know the status of the second?
I think absolutely the sibling should stay home. I actually didn't know that was happening. So I think that it's important for any exposures to isolate or to quarantine until their period is up or until they've been able to test negative within the time frame that's approved. There should no way should a sibling of a positive contact be at school.
I would agree with that, and I would also echo Dr. McFarland. I didn't know that was a thing.
I promise you it's a thing. It's sure a thing. I'm just gonna leave it right there, but I'm just telling you, it's teachers, is it a thing? It's a thing. Yeah, it's a thing. And see, this, Doctor, this is an important point. Let me give you the explanation that was given about why this is a thing. I'm told this is a thing and allowed to be a thing because the second sibling is not showing symptoms. And so my question is, well, there's asymptomatic spread. So how do we know? Keely, I see you high-fiving and everything. I don't know if that's a big amen or whatever, but doctors, seriously, I'm just, and let me say again, school nurses are stretched to the limit. I get administrators, all this stuff. Another thing is kids showing back up at school before the quarantine is over. There are a lot of things that, and so, some schools have administrators trying to go and, pull those kids out. Some are relying on the nurses to do that. It's a lot. It is a lot to manage, and it seems like asking everyone to wear a mask would be a fair trade-off to decrease some of the stress of all of these things that are happening. But Dr. Greenhouse, I'll go to you. These are definite things where siblings of students who have tested positive are in school, where kids who have not finished their quarantine are showing back up, where, even kids who have been notified that they need to be in quarantine, they're not required to have a negative test before they go back. So in a sense, I really don't know what we're doing.
Well, I wonder if that isn't a little bit of a call to action for all of us. If perhaps we're not getting the message across well enough that, okay, little Jimmy just tested positive. Here's what needs to happen to little Jimmy's brother and sister. Here's what you guys need to do. And I'll be the first one to say, I absolutely do talk about quarantine as a family unit kind of thing. But do I specifically address, particularly in these days when I'm out in the parking lot telling people their kid has COVID after we got a test, and especially if it's raining out in that parking lot and you're trying to minimize the time you're out there in the rain,
Right.
do I really spend a lot of time addressing what the plan is for the siblings? I don't. And perhaps that's something that we need to be working on our end to make sure that people understand that. That just kind of hit me like a ton of lead bricks. I mean, honest to God, I really didn't know it was a thing.
It
But
really is.
now that I do,
Yeah.
I really think there's potentially a lot that we can do on our end that really may help that.
Mhm. Well, and that would be wonderful. I mean, if that is a solution or an improvement that comes out of this dialogue, my God, thank God. Because here's the thing. I think that from the school perspective, their goal is to keep kids in school as much as they can, right? And they're getting pushback and trying to limit quarantine and all of that. But if you don't know the status of the kid, it's defeating the whole goal and purpose. And so to be able to go over to R2I2 or whatever and get a test and get your results in 48 hours is absolutely worth it if you can come back with a negative test versus risking asymptomatic spread to a whole classroom.
Absolutely.
Okay.
Maybe we could give a school excuse to the sibling for the number of days when we see a positive test.
That would be great.
I mean, just thinking about that, I have to jump in and reiterate how important I think it is that we tackle this.
I think that's a great idea, Dr. Bartlett. And I think that's a practical solution to help address that. Because, I mean, if you have one sick kid at home, and if the other kid can still participate, and isn't showing any symptoms, that's great. And if the teacher can provide some work for them to do and all of that's wonderful. You can work that out. But, you're going to have to provide childcare for the sick child. And so to be able to provide that clarity to schools and administrators and parents, about what they need to do, to help mitigate that risk, I think that would be fantastic. There was one last question that was in the list of pre-submitted questions saying, I know it's big bucks, but is there an option if schools do not accept the South Carolina money? They're getting at the heart of the proviso, which essentially says schools cannot use state money from the current budget year to enforce a mask mandate. And the technical answer is the federal government has said it will cover that money, right? But the practical answer is school boards and school administrators don't want that political fight. I mean, that's just the practical sense of that. And nobody wants to go through the complication of losing money and seeing how long it's going to take for federal money to come to replace that. The answer lies right now with the Supreme Court. It's been more than a week since they had that hearing. I don't know if that's a good sign or a bad sign that they didn't rule it out and say no, with the Columbia case last week. But I've been hitting refresh on the Supreme Court page all day, every day, and there's nothing yet. You're right there with me, Steve. Yeah. So far this week they've only ruled on a custody case that has nothing to do with what we're talking about tonight. So let's do our round robin. Keely, I'm going to start with you. The one thing that we can do, meaning parents, teachers, the stakeholders in the community, again, with our whole goal of just keeping schools open and keeping students, teachers, and staff safe, the one request you have of all of us tonight.
Quarantine for the number of days you're supposed to. And if your teacher makes it difficult for you, please reach out to people, administrators at your school to help. But that is my number one thing, to quarantine the time you're supposed to.
Thank you very much. Katie, what's your number one thing?
I think on an elementary level especially, but I would argue at any level, that as a teacher, I feel like as teachers, we need to take ownership of the changes we can make in our classroom and foster that environment of this is what we're going to do to stay safe. We can only control what we can control, but children are impressionable. If I show up with a mask, if I'm wearing mine every day, if they see me washing my hands, they see me following safety protocols and talking about it and making sure they're aware of it, even though I can't mandate mask, I can make it very popular. So the more I can do to encourage kids to follow that, and as a school, the more school communities can build that environment, I think you'll see more parents willing to do it. I think you'll see more kids willing to wear masks. But I do think it can be classroom, school, district, but it has to start with somebody building that environment of this is important and this is what we're gonna do to keep kids safe.
Fantastic. Dr. Bartlett, what's your one thing?
Oh, there's so many, and we're not allowed to say masks because that's a given, right? Don't send your child to school if they are sick. Yes, that's my big thing.
That's an excellent one. Dr. Smith, what's your one thing?
It would go back to communicate. So teachers communicate, make sure kids know that they're going to be okay, and parents communicate.
I love that. I love that. Dr. McFarland, your one big thing, your one ask.
Well, everybody's taken all the good ones, but I think, definitely keeping the sick kids home, encouraging masks as much as possible. And my biggest number one besides those would be to just encourage people to get tested and complete their quarantines as well.
Absolutely. Nicole, your one big thing.
One of my worst traits is my eternal optimism. And I am still hopeful that the legislature can go back and do the right thing. I would ask people to contact their legislators, to ask them to ask the Senate and the House leadership to call them back into session and to right this wrong. It is not too late. It is not too late.
Steve, your one big thing.
Nicole stole my thing, but what
You
I
can
what I would
reiterate it.
what I would add to that, well, because I do think one important thing of this to me is we want to do all these things and we all agree in the layers, but I'm hearing over and over again that we really should be masking, so we should keep pushing for that. But I would say if I had to add something to that, it would be my experience has been you can't, and I teach research and I tell kids this all the time, you can't change most people's minds about anything. And confirmation bias is really strong, but I do think that we need to try to have more conversations with our neighbors and our coworkers and our kids and everybody else who about things like vaccines and masks, really have conversations with them, which is hard because you feel like you're undermining everything I'm trying to do to try to keep people safe. And it's really hard to remember that from their point of view, there's some narrative that they're the good guy. And so it's really hard to do that. But I would just encourage people to, take all this great information like we've talked about tonight. And I don't know that it's going to work to try to ram it down somebody's throat, but to have a real conversation about these issues and try to get them to think about it would be, I guess, my, after you call your legislature, that would be my thing.
Wonderful. Dr. Greenhouse, your thing.
I think my thing would be that as adults in our community, we all need to model the behavior that we want to see from our children in schools. And that if we all do model that behavior, then I think that's when we will see some positive outcomes. Other than that, I would echo Nicole that we absolutely need to keep reaching out to our legislators. I really do think that most of these folks do have children's best interests at heart. And I do think, as she said, it's not too late. They can pivot just like everyone else can pivot. So the more people that reach out to them and ask them to do that, the more chance there is that it happens.
Well, I cannot thank you all enough. I know we've gone a little bit over the time, but I just thought those questions were so important and wanted to answer as many as we can for the people who invested their time as well to join us this evening. I will just reiterate a couple of really important points as we talk about contacting legislators and even dealing with each other in the community. I would just encourage you to be very clear about your communication, because contacting your legislature or lawmakers, legislators, does not mean that you're asking them to institute an automatic mask mandate. The ask is for them to allow local school districts the power to make the decisions that are best for their districts in communities that have, the whole state is high spread right now, but we were at a point where not every county in the state had a high level of disease spread. So my point is, it wouldn't be an automatic mask mandate for the state, if that's somebody's objection, but it would give local school leaders the power that they've always had to make decisions for their school district. So I think it's important to be clear how we communicate that. Also, I've gotten a few questions about the Columbia mask mandate because people were like, well, wait a minute, it was struck down by the Supreme Court last week and now they've passed another one. The easiest way to explain that is that in the mandate last week, the original mask mandate they had, it was incumbent upon school leaders to enforce it. They have changed the way that it is written. And so now they specifically say in the order, school leaders cannot announce it, cannot enforce it, and they believe that it will stand a legal challenge. Nobody's announced or any intention to challenge it legally, but they believe it now meets that legal standard because the order makes it clear that no one associated with any school has any obligation. In fact, they are forbidden from announcing it or enforcing it, and that the city will provide masks and provide complete enforcement. So that's where that mandate stands. And my one thing that I want to close with is just be respectful. It goes back to what Dr. Greenhouse said, to model the behavior that you want to see. Communicate with our nurses, our school teachers, our administrators, the way you would like to be communicated with. And that's just with a level of respect and, to realize that public schools have a responsibility to protect all of the children in their care. And in South Carolina, many of those children have underlying health conditions that put them at greater risk for severe illness. And our younger children have no protection at all. They are counting on us to protect them. SC for Ed, thank you for all that you do for hosting this forum tonight. To all of our doctors and our teachers and experts, thank you for being so generous of your time this evening, and just all that you do on a daily basis to invest in the health and safety and well-being of our children and of our schools. So thank everybody for joining us. I'll see y'all in WIS tomorrow and out and about on the next Facebook Live. All right, thanks everybody. Have a great night.
Thank you.